Condoms work by keeping semen from entering the vagina. The male condom is placed on the penis when it becomes erect. It is unrolled all the way to the base of the penis while holding the tip of the condom to leave some extra room at the end. This creates a space for semen after ejaculation, and after it less likely that the condom will break. Advantage: condoms do not physically alter the fertility of the person using them. They are a single-time use and throw contraception method. There is no hindrance to the person being able to conceive the very next time they want to have sex. Protection against STI by using a condom, which essentially creates a barrier preventing exchange of bodily fluids. Many common sexually transmitted diseases such as HIV can be avoided. This is a major advantage for those not in committed relationship. Those who regularly change partner are strongly advised to use the protection of condom. The condom is easy to use, unlike methods where the healthcare provider is required to administer the contraception method, such as hormone injection or embedding an IUD. The condom can be used with no special skills. The product is freely available from a number of places, from grocery stores to condom dispensing machines in public restroom and even online. It is possible to pick up a pack of condoms with a great ease.
Good day everyone! Today I'm going to demonstrate on how to use condom. Condom comes in different shapes and sizes. There are also different colors and texture. It is important to find a condom that is comfortable for you and your partner. So I have here a type of lubricated condom. This is a Trust. So the first thing to do, check the expiration date. Check the expiration date of the condom on the package to make sure that condom is not expired. So the expiration date here is 2025. Then open the condom. Open the condom package. Never use your teeth or scissor or any other sharp objects because you may rip the condom or cut. This is now the package. Before sex, take out the condom. It should look like a little heart, like this. Hold the tip of the condom to remove any air. Place the condom on the tip of the penis, then roll down the condom to the base of the erect penis. The condom should roll easily. If not, it is maybe inside out, or you should throw it and get another one. So this is now the penis with condom. So this is now the penis with condom. And note, use condom for only one sex, not twice or thrice. Thank you.
Disadvantage: reduced sensitivity during intercourse is commonly voiced concern with couples who option for condoms as an contraception method. Some couples claim that the pleasure during sexual intercourse is reduced due to the latex barrier posed by the latex condom. After ejaculation, the male must pull out of the vagina before the penis becomes flaccid to avoid the condom slipping and accidentally releasing the semen into the vagina. This may be difficult to do every time. Incorrect removal and disposal of the condom may cause unintended pregnancy. Condoms cannot be used with oil-based lubricant, only water-based ones. Oil-based lubricants can cause the latex materials of the condoms to disintegrate and the condoms may tear during actual intercourse. Those with latex allergies may not be able to use regular condoms. An alternative would be to use polyurethane and condoms or condoms made out of lambskin. These are more expensive than regular condoms.
Cervical cup, a deep silicone cup that fits against the cervix, prevents sperm and bacteria from entering, serves as a physical barrier between sperm and the cervix. Ang cervical cup daw ay para siyang nipple ng baby bottle, tapos nilalagay ito sa cervix ng babae. Pinipigilan nito ang pagpasok ng sperm sa loob ng babae, bali barrier din ito ng sperm at ng cervix. It should always be used with a gel that immobilizes or kills sperm. The gel forms a physical cellulose barrier in the front of the cervix and lowers the pH of vaginal fluid, thereby inhibiting sperm motility. Sa paggamit nito, dapat sabay siyang gamitan ng gel or ng spermicide. Itong gel na ito ay nakakatulong din magpababa ng pH or ng vaginal fluid ng babae. Cervical cup. The cervical cup is birth control contraceptive device that prevent from entering the uterus. A cervical cup is reusable rubber cup that fits tightly over the cervix. The cervical cup is inserted into the vagina with spermicide before sex to prevent pregnancy. Ito daw ay device na nilalagay sa cervix. Nilalagay ito sa vagina ng babae kasama ng spermicide bago mag-sex at para maiwasan ang pagbubuntis. No hormones can be used by women who are breastfeeding. Available in 3 different sizes. Higher failure rate compared to other type of contraception. Increased risk of recurrent urinary tract infection. Increased risk of toxic shock syndrome. Some women may have trouble inserting it correctly. Gel must be applied after each act of intercourse. A poor fit or silicone allergy will prevent some women from using this cup. Does not protect against STIs. Which type of contraceptive method? The cervical cup. The cervical cup or FEM cup is a soft thimble-shaped cup made out of silicone or latex. It fits snugly over the cervix where the uterus opens into the vagina. It's designed to block sperm from reaching the woman's egg. That's why it's called a barrier method of birth control. Ginawa ito or ginagamit ito para maharangan ang pagpasok ng sperm sa vagina ng babae. Tinatawag din itong barrier method of birth control. Advantage: it does not affect future fertility for either the woman or the man is used only at the time of sexual intercourse. It is safe to use while breastfeeding. Ang advantage ng paggamit ng cervical cup ay hindi ito nakakaapekto sa future fertility ng babae or ng lalaki. Ginagamit lamang ito sa oras ng pagtatalik at safe din itong gamitin ng mga nanay na nagpapadede. Mas mura din ito kaysa sa mga hormonal method of birth control. Disadvantage: the cervical cup is more difficult for women to learn, to insert and to remove than the diaphragm. If worn for more than 2 days or 48 hours, you run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Ang disadvantage naman ng paggamit nito ay mas mahirap siyang matutunan na ilagay at alisin, di kagaya sa diaphragm. Tapos, pag hindi mo siya natatanggal ng more than 2 days or 48 hours, risk ka for toxic shock syndrome o yung bacterial infection or ang pagbaho ng vagina mo.
Contraceptive ring. What is contraceptive ring? The vaginal ring or NOVA ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progestogen into the bloodstream to prevent pregnancy. At a glance, facts about the vaginal ring. If used correctly, the vaginal ring is more than 99% effective. One ring provides contraception for a month, so you don't have to think about it every day. You can continue to have sex when the ring is in place. Unlike the pill, the ring still works if you have sickness like vomiting or diarrhea. The ring may ease premenstrual symptoms, and bleeding will probably be lighter and less painful. Some women have temporary side effects, including more vaginal discharge, breast tenderness, and headaches. Concepts and definitions. The ring steadily releases the hormones estrogen and progestogen into your bloodstream, which prevents the release of an egg each month. How to insert the ring. Step 1. With clean hands, squeeze the ring between your thumb and finger and gently insert the tip into your vagina. Step 2. Gently push the ring up onto your vagina until it feels comfortable. Number 3. Unlike a diaphragm or cap, the ring doesn't need to cover the entrance to your womb or the cervix to work. Number 4. Using your fingers, check regularly that the ring is still there. If you can feel it but you're sure it's there, see a GP or nurse. The ring can get lost inside you. Number 5. After the ring has been in your vagina for 21 days or 3 weeks, you remove it. This should be on the same day of the week that you put it in. How to remove the ring. Number 1. With clean hands, put a finger onto your vagina and hook it around the edge of the ring. Number 2. Gently pull the ring out. Put it in the bag provided, throw in it the bin. Don't flush it down the toilet. Who can use the vaginal ring? Some women can't use the vaginal ring. It may not be suitable if you have had a blood clot in a vein or artery. Number 2. Have had heart or circulatory problems, including high blood pressure, are 35 or older, and smoke or stopped smoking in the past year. Number 3. Have migraine with aura warning symptoms, have had breast cancer in the past 5 years. Number 4. Have diabetes with complications, or overweight, take medicines that may interact with the ring. Number 5. Can't hold the ring in your vagina. Number 6. If you don't smoke and there are no medical reasons why you can't use the ring, you can use it until you're 50 years old. Advantage. Number 1. It doesn't interrupt sex. It's easy to put in and take out. Number 2. You don't have to think about it every day or each time you have sex. The ring is not affected if you are sick, vomit, or have diarrhea. Number 3. It may help with premenstrual symptoms. Period type bleeding usually becomes lighter, more regular, and less painful. Disadvantage. Number 1. You may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. Number 2. It may cause temporary side effects such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. Number 3. The ring doesn't protect against STIs. Number 4. You need to remember to change it and put in a new one. If remembering to do this is difficult, a longer-acting method such as the contraceptive implant or intrauterine device or IUD may be more suitable. Number 5. some medicines can make the ring less effective, see a GP, nurse, or pharmacist for advice. Number 6, it may take a while for you to return to normal fertility. In some women, this may take up to a few months.
Spermicide, a chemical called nanoxynol 9, comes in the form of cream, gel, foam, film, or suppository. By inserting spermicide in front of the cervix, in the vagina, it destroys sperm or stop it from moving. Karaniwan, ang mga spermicide ay pinagsama sa mga paraan ng contraceptive barrier tulad ng diaphragm, condom, cervical caps at sponge. At ang mga pinagsamang pamamaraan ay pinaniniwala ang nagre-resulta sa mas mababang rate ng pagbubuntis kaysa alimang paraan. Spermicidal film must be inserted into the vagina at least 15 minutes before intercourse. It will melt and disperse. If more than 3 hours had passed before intercourse, another film must be inserted. The side effect of using spermicide is temporary local skin irritation involving the vulva, vagina, or penis is the most common problem associated with spermicide use. The advantage and disadvantages of using spermicide. Advantages: spermicide is easy to use and affordable. No hormones. When used with another method, effectiveness increases. May also protect against bacterial infection and pelvic inflammatory disease. And for the disadvantages, spermicide is not highly effective. Must be inserted before sex because it's only effective for 1 hour. May irritate the entrance of the vagina or the tip of the penis. May increase the risk of HIV transmission. Spermicide does not protect against STIs or sexually transmitted disease.
Contraceptive injection. The contraceptive injection releases the hormone progestogen into your bloodstream to prevent pregnancy. Depo-Provera is most commonly given in the UK and lasts for 13 weeks. Typically, Depo-Provera is 97% effective. This means 3 out of 100 people using Depo-Provera will get pregnant each year. If you have your injection on time, it can be more than 99% effective. How does contraceptive injection work? The injection works by preventing the ovaries from releasing an egg each month. It also thickens the fluid around the cervix. This helps to prevent the sperm from reaching the egg. Side effect of contraceptive injection. Side effects can include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods may become more irregular, heavier, shorter, lighter, or stop altogether. Advantage of contraceptive injection. Doesn't require daily action, eliminates the need to interrupt sex for contraception, decreases menstrual cramps and pain, lessen menstrual blood flow, and in some cases stop menstruation. Decrease the risk of endometrial cancer. Disadvantage of contraceptive injection. Uneven menstrual period or no period at all. Headaches, nervousness, depression, dizziness, acne, change in appetite, weight gain.
Oral contraceptive pill. What is it and how does it work? Also known as birth control pill. Suitable for most healthy women regardless of age and can be used long term. one of the world's most prescribed medications. The pill is taken every day, ideally at the same time each day. Traditional pills are set up with pills for 3 weeks, followed by a pill-free week or a week of placebo pills. It works by preventing the ovary from releasing an egg, thickening the cervical mucus, making it difficult for the sperm to reach the egg, and changing the lining of the uterus, making implantation difficult. 2 kinds of oral contraceptives. The combined oral contraceptive, which contains both estrogen and progestin, and the progestin-only contraceptive. Advantages of oral contraceptive pills. Highly effective, reversible, does not interfere with sex, may reduce or eliminate menstrual flow and cramps, regulates menstrual cycle, decreases premenstrual symptoms. Disadvantages of oral contraceptive pills. Effectiveness may be reduced by other medications. May cause irregular bleeding or spotting. May cause breast tenderness, nausea, or headaches. Must be taken every day at the same time. May increase the risk of blood clots, particularly in women who have certain blood disorders or a family history of blood clots. Does not protect against STIs. Advantages of combined oral contraceptive. It decreases acne. It decreases body and facial growth. It reduces the risk of endometrial, ovarian, and colon cancer. It reduces the risk of fibroids and ovarian cysts. It may reduce perimenopausal symptoms. Disadvantage of combined oral contraceptive. Should not be used by women over the age of 35 who smoke. Advantages of progestin-only contraceptive. May be suitable for women who cannot take estrogen. May be suitable for breastfeeding women. May be suitable for women over 35 years old who smoke. Disadvantage of progestin-only contraceptive. Some women may have hormonal side effects such as acne, headaches, breast sensitivity, mood issues, and unwanted hair growth. Disadvantages of female sterilization. Permanent and irreversible. Risk of having regrets later on. Possible short-term surgery-related complications such as pain, bleeding, infection at the incision site, trauma to adjacent organs in the abdomen. Under tubal occlusion, hysteroscopy. Using only local anesthesia, a gynecologist will put microinserts in your fallopian tubes through a vaginal approach. It takes 3 months for this method to be effective, at which time a confirmation test is done to make sure the tubes are fully blocked. Tubal ligation and tubal occlusion. What is it and how does it work? Female sterilization by tubal ligation is a permanent surgical procedure where the 2 fallopian tubes, which transport the eggs from the ovaries to the uterus, get disconnected. Female sterilization by tubal occlusion is a permanent procedure where a microinsert is placed into each of the fallopian tubes. The microinserts work with your body to form a natural barrier that keeps sperm from reaching the eggs, preventing pregnancy. Advantages of combined oral contraceptive. Highly effective, reversible, does not interfere with sex, may reduce or eliminate menstrual flow and cramps, regulates menstrual cycle, decreases premenstrual symptoms. Disadvantages. Should not be used by women over the age of 35 who smoke. Advantages of female sterilization. Safe, long-lasting permanent, highly effective, simple procedure, does not interfere with sex, no hormones, discreet and cost-effective, does not affect sexual function. Advantages of tubal occlusion. No incisions or scars, can be safely performed in an outpatient setting. Advantages of tubal occlusion. Not effective immediately when microinserts are used. Must use another contraception method for 3 months and do a follow-up confirmation test that shows if tubes are fully blocked. Possible procedure-related complications during and following the microinserts placement, such as pain, cramping, and vaginal bleeding.
vasectomy is a male sterilization by vasectomy is a permanent surgical procedure to close or block the vas deferens, the tubes that carry sperm to the penis. This option is especially for those who have decided that their family is complete or that they don't want to have children. The vas deferens is partially removed or blocked so that no sperm is released for fertilize the egg. Using local anesthesia, a health professional will reach the vas deferens either by making a small incision on the skin of the scrotum, conventional vasectomy, or by making a small puncture on the skin of scrotum, no scalpel vasectomy. Another form of contraception is required until a semen analysis show no sperm.
The advantages of the vasectomy: first, it is a safe, long-lasting, permanent, highly effective, simple procedure, no follow-up required aside from sperm and analysis, does not interfere with sex, no hormones, secrets and cost-effective, does not affect sexual function. Less invasive and fewer complications than female sterilization, no significant long-term side effects, allow the male partner to assume some responsibility for contraception. And the disadvantages of the vasectomy: first, is a permanent and irreversible, risk of having regrets later on, not effective immediately, must use another contraception method for 3 months, and do a follow-up sperm analysis that show no sperm are present in the semen.
There are 4 types of diaphragm. Number 1, arcing spring diaphragm. It has a firm rim and easiest to insert. Best for women who are weak vaginal muscle tone. This is the most common type of diaphragm. Number 2, flat spring diaphragm. Similar but has a thin rim. Best for women who had strong vaginal muscle tone. Number 3, coil spring diaphragm. Has a soft rim but is flexible, best for women who have average vaginal muscle tone. Number 4, wide cell rim diaphragm. It's a silicone option, best for women who are allergic or sensitive to latex. Advantages of diaphragm or cup. Number 1, is not as effective as other types of contraception. It depends on your remembering to use it and using it correctly. Number 2, is that not provide reliable protection against sexually transmitted infection. Use condom as well to protect yourself. Number 3, it can take time to learn how to use it. Number 4, putting it can interrupt sex. Number 5, cystitis can be a problem from some women who use a diaphragm or cup. Number 6, latex and spermicide can cause irritation in some women and their sexual partner. Number 7, should not use diaphragm during your period as there is a possible link with toxic shock syndrome. Advantages of diaphragm or cup. Number 1, you only need to use a diaphragm or cup when you want to have sex for at least 3 hours before having sex. Number 2, you can put it in at a convenient time before having sex. Use extra spermicide if you have it for more than 3 hours. Number 3, there are usually no serious associated health risks or side effects. Number 4, you're in control of your contraception. Number 5, diaphragm placed at least 6 hours after sex.
For following insertion, 5% of women may experience bruising and local irritation or pain. Almost 15 years of women using the implant complained of vaginal dryness. Headache occur in a quarter of all women with the implant. Women also feel dizziness, dysmenorrhea, back pain, emotional instability, nausea, mood swing, and hypersensitivity. This contraceptive implant is placed by a healthcare provider in the upper inner arm just below the skin. The progestin hormone prevents the ovaries from releasing an egg. It also thickens the cervical mucus, making it difficult for sperm to reach the egg. The contraceptive implant. What is it and how does contraceptive implant work? Contraceptive implant is a 4 cm long and 2 mm wide flexible rod that sits just below the skin and continuously releases a progestin hormone into the bloodstream. The disadvantages of contraceptive implant. Initially, irregular bleeding is the most common side effect. Some people may have hormonal side effects, acne, headache, breast sensitivity, and mood issues. This contraceptive implant does not protect against STIs. Some pain or discomfort during insertion, and after insertion, there may be some soreness or bruising of the upper arm. Here are some advantages of contraceptive implant. It is high effectiveness of up to 99% within 7 days of implant insertion. It is very inexpensive method of long-term contraception comparable to intrauterine devices. It is safe in majority of women. Efficacy for 3 years without further intervention. Safe for use during lactation and doesn't interrupt sex.
Sponge, small, disposable polyurethane foam that displays in the vagina. It fits over the cervix to provide a physical barrier to prevent sperm from entering. The contraceptive action of the sponge is primarily provided by the spermicide, which is slowly released over a period of 24 hours. The spermicide absorbs and traps the sperm and destroys the sperm cell membrane. The sponge can be inserted into the vagina by the woman using it up to 24 hours before intercourse. One side has a concave dimple that it fits over the cervix. The other side has a lobe to facilitate removal. It comes in one size only. Protection begins immediately when inserted and lasts for 24 hours even with repeated act of intercourse. It should be left in the vagina for at least 6 hours after the last act of intercourse, but should not remain in the vagina for more than 30 hours total. The advantages of sponge: offers a barrier method and spermicide in one. Provide 12 hours protection and doesn't need to be replaced for repeated sex during this time. Enhance the effectiveness of other forms or contraception such as condoms. No hormones. Available at pharmacies without a prescription. The disadvantages of sponge: higher failure rate compared to other types of contraception, increase the risk of vaginal and cervical irritation or abrasions, which increase the risk of transmission of HIV. Some women may have trouble inserting it correctly, does not protect against STIs.
Intrauterine contraception or IUC. What is it? How does it work? Long-acting reversible contraceptive methods. Small T-shift device that are inserted in the uterus by a healthcare professional in a clinic. Most effective forms of birth control available. Depending on the device, the IUC can remain inserted for 3 to 10 years before needing to be replaced. Two types of intrauterine contraception: the copper intrauterine device and the levonorgestrel releasing intrauterine system, which contains a progestin. Advantages: highly effective, reversible, long-term forgettable and initiable, cost-effective, safe, may be suitable for women who cannot take estrogen, may be suitable for breastfeeding women. Disadvantages: initially, irregular bleeding or spotting may occur. Expensive. Some pain or discomfort during insertion. Rare risks with the insertion could include infections, perforations of the uterus, or expulsion of the IUC. Does not protect against. Levonorgestrel releasing intrauterine system. The small cylinder on the IUC contains the hormone levonorgestrel, which is slowly released. The lining of the uterus becomes thinner and the cervical mucus becomes thicker, which makes it harder for sperm to enter the uterus. Advantages: a minimal amount of hormones is absorbed in your blood, may reduce menstrual flow and cramps, regulates menstrual cycle, improves symptoms and endometriosis. The disadvantages: some women may experience hormonal side effects, acne, headache, breast tenderness, and mood issue. Irregular periods, light or no menstrual period, which some think and as an advantage, other as a disadvantage. Copper intrauterine device OCU IUD. The presence of the foreign body, the IUC itself, creates a hostile environment leading to prevention of a pregnancy.